Hi, this is Kelly, and in the following videos you will see the proper procedures for hand hygiene, donning and doffing, vital signs, and auscultation. Hope you enjoy! So first you want to turn your water on. Make sure it's a little bit on the warm side. Wet your hands and give yourself a good amount of soap so you can lather thoroughly your hands as well as your forearms. This process should take about 15 to 20 seconds. And for those of you that like more of a visual or way to remember this, you can sing happy birthday or your ABCs, and by the time you're done with that, it should be 15 to 20 seconds. But you want to make sure that you get inside the nails, around the nail beds, and inside the fingers. And then rinse. And before disposing of your paper towels, you want to go ahead and turn your faucet off, making sure not to touch any of the fixtures. And then we'll go ahead and dispose that. And that would be proper hand hygiene. Next, we'll begin with donning of the PPE. Okay, make sure that all your hair is covered up. Go ahead and put the shoe covers on. Make sure that your pants are properly inserted into the booties. Okay. Next, we'll go ahead and put the gown on. You have ties around the neck and ties around the midsection. I like to go ahead and tie the upper portion first. It's actually a little bit more tricky than it looks, but you go ahead and get that top portion tied securely into a bow. Then you can go ahead and pull the gown. Make sure that your back, all your clothing is covered. Come around the side and tie this section into a bow as well. Then next we'll go ahead and put our mask on. The metal portion at the top, and make sure that fits securely around the nose. The elastics go around the ears. You want to pinch the nose and pull downward. And then we have our gloves. You should make sure that when putting on your gloves that they actually stretch over the gown, like so, as to prevent any contamination from entering your clothing or skin. Okay, and then that is PPE donning. To remove the equipment, we begin with the gloves. So, assuming that they're contaminated, you want to wad it up in the gloved hand and then remove it by pulling over and disposing. Next, we'll go ahead and remove the mask and dispose. Next, we would remove the gown. I like to just reach inside, pull down, pull out, and then wad it and dispose. Next, we have our head piece. We can dispose of that. And then finally, we can remove our shoe covers, properly dispose, and before leaving the patient's room, we want to go ahead and follow the same procedures as we did when entering the patient's room or before any procedures for hand hygiene to eliminate any cross-contamination from patient to patient. Dispose. And that is proper hand washing, donning, and doffing. So first I'm going to begin. This is my patient. This is McKenna. McKenna, how old are you?
8.
You're 8. And when's your birthday?
December 1st.
December 1st. Can I check this and see? You are right. It says your name, McKenna, and it says your birthday is 12/1. Wow, what a big girl. Do you mind if I go ahead and take your vital signs?
Mm-hmm.
You do? You mind? Or can I?
You can.
I can. Perfect. All right, let's start with your temperature. It looks like McKenna's not feeling well today. She has a temperature of 99.5. All right, let me go ahead and check that pulse of yours. In 30 seconds, McKenna had a pulse rate of 36. So we would go ahead and multiply that by 2, giving us a pulse rate of 72. All right. Just continue to sit there. Okay, to calculate respiration rate, I went ahead and I watched her respiration for 15 seconds, and that was 5. Then we went ahead and multiplied that by 4 to equal a minute, so we end up with 20 breaths per minute. When you feel my stethoscope, go ahead and take a big breath for me. Good job, McKenna. Can I go ahead and get your back? Perfect, McKenna. Great job.
Now McKenna was born with a CCAM, which is a tumor, and it encompassed her left lung. Okay, so her breath tones on the upper lobe are certainly diminished because that is the lobe that was removed. There is some, you can hear some inflation, but it is certainly lessened or decreased versus her other side. All right, you did a great job. Thanks for being my patient. Thanks for watching. I hope these demonstrations were both educational and informative to any aspiring health professional. Thanks for watching.